Shalom, this is Graciela Salinas. And I just want to tell you that we survived the NCLEX test, the new Next Gen test that started in April this year. Graduate nurses from the USA and also those who were educated internationally were trembling about the fact that this test was going to be absolutely new with new kind of questions and different things. Some of us educators, those of us who teach and prepare nurses or students for the test, were also holding our breath. We were expecting the worst with the introduction of this kind of a test. Again, it started in April 2003, but we survived. So the first quarter passing rates are out for this new generation, and we saw an amazing increase in the number of both registered nurses and licensed practical vocational nurses candidates who successfully passed the test. So let me show you right now. I'm going to share my screen, and I'm going to share the statistics from the NCLEX. This is the NCLEX, as you can see it here, and I'm looking at this other area because that's what I'm sharing, the other screen. But if you can see, this is from the 2023 quarterly. The National Council of State Board of Nursing releases the pass rates. So let's see right here. These are numbers that have never been seen before. I had been looking at these statistics, wow, for at least 23 years. I started teaching in 98, but I didn't know much about all these items. So it wasn't until about 2000 that I started following the statistics, and I have never, ever seen anything in the 90s. Look at this. So you know that to get the test, to be able to sit for the test, the NCLEX, you can have either one of three levels of nursing: diploma, the associate degree, or the bachelor's degree, which is the licenciada en enfermería. It's the same test. It's not like in Mexico that you have Ceneval, and Ceneval is two different levels for two different kinds of nursing. The enfermera general and the licenciada en enfermería have different tests. Not NCLEX, same test. So as you can see, the one with the highest level of passing always has been the BSN, the bachelor's. So it was a 95.34 compared to 83.26, about a 12% increase, which is amazing. Then the diploma nursing programs got 94.93 compared to 78. That's amazing. Why is that? Well, diploma nurses are those who learn nursing at a hospital-based program. And I will tell you a little bit more about this. And then associate degree jumped to 93.94. Many programs were struggling during the previous years, previous quarters. But now, as you can see, 93.94% rate. So many people had been passing this. And then invalid codes, that means that they wrote a code and maybe it was a special code or maybe they wrote it wrong, but that doesn't prevent the candidate to take the test. These are all US educated nurses. So even if they wrote the wrong code, they still can take the test, but they're not cataloged with the nursing school. So you can see that even then, they improve. And these kind of special codes, they had been always the lowest in passing rates, and even they got an increase of about 27%. So overall, for everyone, we had an increase to 94.33, which is 14% above what it used to be. So you can compare here. Now let's look at the internationally educated nurses, which you can see here on the next area. First time internationally educated nurse, it jumped from 39.86 to 57.69. I have never seen numbers like that before, not in the 50s anyways. The highest that I have seen before was in the mid to high 40s, but never in the 50s. And now look at this, 57.69 for first timers. Even the second timers jumped to the 50s. It used to be that it will be, as you can see, it decreases from 39, the last quarter, from 39.86 when they had to repeat only 28.85 passed. But this time, it was amazing. Almost everybody passed, even for second timers. I mean, it was almost the same level of passing. Not everybody passed, but from 57 to 51. So it was also a huge increase. So this, what does this means? Let me stop sharing for a minute, and I'll go back to telling you what this means. Well, I have been having conversations with my colleagues here in the United States, those nurses who are teaching at community colleges or universities in a school of nursing, people I used to teach with, or that continue to invite me to do lectures. We have classes together sometimes because we have to have a requirement for our education. So what I have heard from these programs is that many of them who were struggling for passing, now they got 100% passing rate. Wow. Several programs throughout the United States got 100% passing rates. And so you can see that this is dramatic. This is huge. So now we can breathe easier. We educators can breathe easier because we can see that whatever change we made, it's proving good, positive. And also the students, the US students and the international candidates can also feel a little bit more relief, but just a little bit. So how could this be? How could be that is easier? Is it really an easier exam with many USA candidates passing with the minimum 85 questions? What's going on? Well, again, having conversation with my colleagues, this is the things that I have heard from them. And these are some of the things that I have also made comments about. So first of all, if you remember, if you have learned about the Next Gen test, you know that it provides partial credit. This partial credit is for most of the items that are select all that apply, the SATA, the famous SATA. The main difference is that the previous SATA, the standard SATA that we are used to, usually had only about 5 choices. The new SATA has up to 10 choices to choose from. So if you don't get all of the correct ones, they will give you partial credit. In some instances, they will also take credit, add or decrease or increase your credit depending on the answer. But listen carefully. This is only in some of the 18 questions that you're going to see on the test that are next gen. It's not on the standard questions. Not the entire test is next gen. It's only 18 questions on the test that is next gen. The rest of them are the standard mode or kind of questions that we used to see in all the previous years. So don't get too used to, or don't start thinking that every question is going to give you partial credit, because that's not true. US candidates, we like the NGN question because it kind of feels like the real nursing practice. However, again, you have to be cautious about this because this is about the real nursing practice of the United States. So whenever you're answering case study questions, make sure that your answer reflect what the practice in the United States, not what's the practice in your hospital or your experience that you're having. You still have to think as an American nurse to be successful on that test. And so we're going to be doing some case studies and other kind of questions to replicate the clinical realities of the United States. Those are modifications that I continue to do as I'm teaching for international candidates. But the NGN, we can say that it aligns better with clinical studies or clinical practice, since these questions on the next gen are more like real life. And students in the USA say that they actually make sense because it's so similar to whatever they read in a patient chart and whatever they see during clinical practice. So again, we have to go into the case studies with the mind of immersing ourselves in those case studies and think about what are we seeing, how is it look like. Again, think like a US nurse. All this is wonderful. And actually the National Council of State Board of Nursing CEO, David Benton, and let me show you who he is. He made some comments about this. What am I doing there? There is David. That is the David Benton, the CEO for National Council. Actually, he's going to be retiring on September 30th of this year. And he said the following, and I quote, "We are very pleased that the launch of NGN was seamless for candidates. The increase in those who pass the exam is a reflection of how well the enhanced test mirrors actual nursing practice. NGN is a better measurement of how safe and competent a nurse is to practice on day one, and that increases public protection." So that was his comment about it, which I'm pleased that he's making comments like that. But how does this translate to improve clinical judgment at the bedside? And what does that mean for us, Mexican nurses? Now, first of all, our education, whenever you take a course, whether if you are with MedTalent or with anybody else, you got to make sure that you think like a nurse and that you use clinical practice based on American nursing, not any other kind of nursing. Since we don't have that experience, the best experience is reading it from the book, because that's where the questions are going to be. So your answer should always be about what did you read on the book, not what I did at the hospital or not what my experience is. And I have said that ad nauseum constantly. I'm repeating that. So don't think that this test is too easy. Think about your real test. What's the real test? The one that you will have whenever you take care of a USA client. Therefore, you have to prepare not just for the test, but for your professional practice when you arrive here in the United States. I'm really interested on how you, the Mexican graduate, will be perceived by our practice partners. What do I mean? So when you pass the test and you come to the United States, how is the hospital going to see you? How are they going to feel about it? And I think that's what we really have to be concerned. Will they make any changes to the current onboarding process and competency accustomation processes? Or will they continue to do the same? Right now, they're offering a very generous onboarding process and competency. And I mean, they give you a lot of orientation and they give you probably a, what is it called? It's not an accustomation, but it's a training that they will put you with a preceptor for sometimes up to 6 months. So will they continue to do that? Or will they think that the test is reflecting a better practice for you? And I hope that they don't. I hope that they continue to give us as much as we need in orientation so that we can improve our practice or make sure we're safe in practicing. Because one thing is the test, another thing is the practice. And also, because of research that has been done for years, I'm very cautious about this. And I'm going to tell you that according to Kavanaugh and Sharpnack, who published in 2011, they were saying that 100% NCLEX pass rates will mean that 9% of the graduates are practice ready. So this is what I learned when I went to school here in Mexico or there in Mexico. I had a friend, a very good friend who I loved a lot. she wasn't the sharpest student in our program. And what happened is that when we were together, I was pretty good academically. I was absolutely good, having all good scores and everything. She was not. But when we went to practice, I kind of struggled a little bit. I was able to make it, but not as good as academically. Her, whoa, she was awesome in clinical. She excelled in almost any clinical practice. So you see that the test will reflect the academic part, but are you really ready to do clinical practice? So I know that some of you struggle with the test, even though you are very good in your practice, and some of you are able to just be successful and maybe struggle in clinical practice. Some of you may be pretty good in both areas, so you have to know what your weakness is and how to complement it. So how can we prepare as we move along for these NGN style questions and case studies and learning activities, etc.? Well, here is one thing that I will do in this program that I'm working, which is with MedTalent. I'm going to make sure that I contextualize the learning content to the USA nursing practice. What do I mean? I wish that, and I will ask my current candidates that if it's possible, they start taking me to their work practice so that we can start doing case studies with their actual patients. I think that will help a lot. We're going to start not just doing things in class, but I want you to live American nursing, eat American nursing, and talk American nursing throughout the day, 24 hours, 7 days a week. All this that is going on is not a coincidence. It's nothing new. In 2010, Dr. Patricia Benner and her co-authors published a book that was called Educating Nurses, A Call for Radical Transformation. Again, this was in 2010. And they identified that educators must bring context to essential content to radically transform how nursing is taught. So at that point, I was still teaching at the university here in the United States. And so we got trained on how to start applying things not only and connecting academia to practice. So what we were teaching in the classroom, we were bringing to clinical practices and then making sure that the students were also connecting their books to the clinical patients that they were seeing. So all these things are going to be reflected in the different kinds of questions that we're seeing in NGN, which supposedly, well, not supposedly, but for sure, is trying to measure critical thinking, clinical reasoning, and clinical judgment, which clinical judgment is the result of your clinical thinking and critical reasoning. So the final step that you take to treat this patient or deliver this kind of care, that's your clinical judgment. After you intake all the things that you have to take into consideration and you decide to do this, that's clinical judgment. So there will be items like multiple choice items like it used to be before. We're going to have the bow tie. We're going to have matrix questions. We're going to have questions that have not seen before. And on top of that, we're going to continue to see the standard questions that we have seen before, like the SATA and the multiple choice and the fill in the blank and the what is the order and the match, all those kind of things that we saw, maybe an image and click, maybe a video and respond, maybe an audio and respond. Most commonly, the audio questions are assessment from the lungs, the heart, or the stomach, auscultation. And so, so many things that you have to be aware and so prepare, because the primary purpose of nursing education is to prepare you, not for the test, yes, for the test, but not only for that, but for your practice. That's where your success is going to really be. So the last time I checked, we're going to continue to do the patient's forehead, to do the assessment or take the temperature the same way. And it's not like, okay, are you going to select alter apply on the forehead? Or are you going to do a 2-column matrix to do an assessment? No, you're going to do everything that you're supposed to do. That's why practice is much more important than the test. However, you have to pass the test to get to the practice. So I guess both of them are equally important. So what are we going to have to do? Final thoughts. To close the gap between nursing in the United States and nursing in Mexico, how it is taught, how it is practiced, all these things which have been documented in the literature for nursing in the United States for more than 50 years. Now we nurses here in Mexico who want to go over there need to take the same approach and use open-ended Socratic clinical reasoning, which these kind of questions will develop your critical thinking and your clinical reasoning, not just the clinical practice. So I know that at the end of all this, what we are wanting to do is that you put your practice first. Use practice-informed questions and ways of thinking, and we can ensure that you are not the only prepared for NCLEX, but more importantly, that you are prepared for world professional nursing practice. My name is Graciela Salinas, and I wish all of you a success story on your NCLEX journey. Shalom.